Boyardee, Jeff Boyardee. What's up, friends? This is TikTok Live number 22. Let's get after it. Just an open Q&A session. Whatever you want to ask, just ask it. Let it fly. It's just us here. I'm recording. I'll put it out on the YouTube channel and the podcast for later on. Let me know any question. Michael Giello, Kelly Hines, Angelique Velez joined, Ari Baby joined, Bobby Murray, Mesopotamian joined. Name. Why would she say that to me? I thought she likes me. She called me FOB. No idea what that means. Sam Boateng joined. What's up, Sam? HUD joined. Beverly joined. Yusuf Southall joined. Katie joined. What's up, Katie? What's up, friends? Open QA session. Open QA. HUD asks, thoughts on Endo applying this June. Awesome. Are you applying to one of those programs where they require you to have a GPR first, or you get to just go right into it? Name. Free off boat? What? I don't know what that means. Usman's asking to have a one-on-one chat. Usman, I don't know who you are. Usman. Hatali joined. What's up, Hatali? Todd joined. Will joined. What's up, friends? Random open Q&A session. Let's go. Let's do it. Let's let it fly. M500 said, Doc, would you believe I've only been to a dentist once in my life? Only had one cavity, 41 years old. Wow. Good for you. Congrats. Are you brushing your teeth? Are you flossing? You did have one cavity, though. When did you go to the dentist one time? Was it recently, or was it years and years and years ago? Are you afraid? Let me know. Why not? Winston Applegate 3. I'm sorry, but in my clear estimate, dentistry is the greatest profession of all time. Why are you sorry? That's awesome. M500 said 3 years ago. So recently. So that was about 38 years old. So you went to the dentist for the first time at 38 years old, you're telling me? Seriously? Kimby's joined, retired hygienist, 30 years. Ooh, Kimby's. Congrats. 30 years. That's a long time. Cleaning people's teeth for 30 years. I mean, you must be outstanding at it, right? I need to go for a cleaning. I definitely need a cleaning soon, very soon. M500, I brush once a day, floss every week or so, I swear. I don't know. I'm not convinced. And still, I think you could up those numbers a little bit. Only one cavity. Sounds like you have pretty good oral hygiene. Or, all things considered, it sounds like you got some good genetics. Maybe not oral hygiene. I don't know. We should ask what your friends think. But it sounds like you got some good dental genes. Carl said, are Crest white strips okay for your teeth? If so, how often should you use them? Carl, I would definitely ask your general dentist what he or she thinks of that, she or he. Because basically there's different levels of whitening. You have the in-house whitening. That's it's a much stronger concentration of the whitening substance or substances that they use. Those whitening strips, I mean, that's kind of up to whatever your general dentist thinks they want you to do or not do, right? It also depends on how sensitive your teeth are. Different teeth react differently to whitening products, okay? Kimby says, thanks, Doc. Yeah, Kimby's. Loved it. Great job. Nice. What are you doing now? Just hanging out, retired, official Sports Talk TV. What's up, friend? I think you got number 1 last week. Official Sports Talk TV. Did you check the rankings? I forget now. I think you were number 1 last week. Guys, so whoever's on right now, when I post this later to podcast and YouTube channel, in the comments, I could see who the top 3 listeners or viewers were on the live session. So I'm putting you top 1, 2, and 3 listeners, viewers. Whoever stays on the longest gets to be in the caption. So thanks for everyone for coming on. All right, let's get to it. How many points would Iverson and Shaq average in today's NBA? They would tear it up. Are you kidding? No one plays defense today. Maybe 80 points a game, 40 between the two of them, maybe more. Smaller teams, Shaq would get more points. Taller teams, Iverson would crush. +1 every day. Is there nerves that make your mouth burn after wisdom tooth surgery? You can get burning mouth syndrome. That's generally associated with trigeminal neuralgia. After your wisdom teeth are removed, it is possible. You might need an MRI. I would look into that. I would visit an oral surgeon, oral medicine, pain, or pathology specialist. I would look into that. I would get a consult there, yeah. Tempe Heat, I'm worried about radiation from x-rays. Why can't I skip the x-rays and just get a cleaning? Because then we can't see if you have anything going on below the gums, right? We can't see. You can always see cavities because sometimes it just looks like staining on the tooth surface. and it's actually a really deep cavity underneath. You need x-rays to do that. And by the way, you get more radiation on a flight to California and back than you do at the dentist office from the x-rays. So something to consider. Steven, my girlfriend just went back to school to do fillings. She's been a dental assistant for 10 years. So she's still in dental assisting and now she's doing fillings? How is that? Is that real? Is that allowed? Kimby said, I live 6 months in the mountains of Colorado, 6 months in Fort Lauderdale, and I'm retired. Wow. 2 houses. How'd you get those 2 houses? That's awesome. Because you got the 6 months in Colorado, you get to go skiing, and then you're in Fort Lauderdale, you're right by the beach. That is an amazing combo. Kimby's, I want to live like you. Official Sports Talk TV. Yeah, I did. Yeah, congrats, dude. Congrats. You got the first spot. That's impressive. I think Luke PreDent came in second last week. Let's see if he signs on. I didn't announce tonight's TikTok Live. So thanks. And everyone who's on right now, congrats and thank you. TikTok Live 22. Ask a question, I shout you out, and then you get on the live thing literally forever because I post these on podcasts and YouTube. Angry Face said, if you're not top of your dental school, do you have no chance of matching into residency? No, that's not true. That's not true. You could still match if you're not in the top of your dental school. You can still potentially match into residency. Alcar433, how do you approach orbital floor fractures with EOM entrapment, extraocular muscle entrapment? That's a great question. There are different ways to approach the orbital floor, right? As far as those fractures, I mean, you could go subconjunctival. You could go, I mean, have we done it here intraorally? We might have done it intraorally. I mean, you could do a coronal flap, bicoronal flap. I don't know if I would recommend that. There's so many different ways you could. Not so many. There are a few different ways you could go about addressing that. It really depends on the comminutia. It depends on what other fractures that are present there, right? Because you need to expose all the other fractures prior to reducing what you are going to reduce. Maybe you're going to place mesh on the bottom of the orbit. I can't answer that question without seeing, And I still need I need more surgeries to do myself, right? I'm going into chief year next year, and that's when I'm going to be doing the bulk of my OR experience. Most of mine has just been in the outpatient clinics. Savage Meerkat, hamsters, what do they want? Why are they like that? I don't know. What? Duriel said, hey, do you think letter of intents work for Stony? Because I interviewed there recently, but haven't heard back. Why not, right? Nothing to lose. I think it would be a good idea. Have you tried calling the dental school coordinator person and making sure that they've received all your application materials? Have you tried that? Have you called them up? I wouldn't email. You'll never get that email back. I would call up and I would ask, hey, I just wanted to make sure my application got a little, I don't know, late, whatever it is. And then just say hey, I just wanted to make sure that you got all my pieces, Plus one every day. Well, my mouth has been burning every day for 2 years after wisdom teeth surgery. Did you see the oral surgeon? Well, first, was it an oral surgeon that took out those wisdom teeth? And 2, did you visit them for a follow-up weeks, months afterwards? Now that it's been 2 years. 2 years is a long time. Official Sports Talk TV, have you ever done macroglossia reduction? I have not. I have not done macroglossia reduction. We have done a glossectomy, hemiglossectomy. Yeah, we've done that. So not for macroglossia, for cancer and such. So yes and no. Kimby's, I worked for 2 different periodontists for 30 years, 3 days a week. 3 days a week is awesome. That's amazing. For 2 different periodontists, that's fantastic. Here's one of the little skeptical things, right? You think that, oh wow, I'm going to become a doctor, a lawyer, a dentist, an engineer. My job's going to be super stable. Going to get a high salary, really nice work-life balance. I'll tell you right now, in residency, there is absolutely no work-life balance. So that's a big misconception. You're not getting paid, you're not getting paid much at all in residency. Literally $69,000 my first year. After taxes, that was $45,000. No, the first year was $43,000, and my rent came out to $31,000 for the year because it was $2,750 my first 2 years. This year and next year is $2,900. Let me break it down for you. This year I get $77,000 for my salary. After taxes, that's like 45, 48, somewhere in there. Regardless, that's $4,000 a month. My rent is $2,900 a month. That's $1,100 $100 left over for groceries, for visiting family, visiting friends, dinner, breathing air, basically. So it's big misconception. Now, Kimmy's, something I want to point out right now is that you're saying you were working 3 days a week for 30 years. I don't know if I'll ever be able to work 3 days a week, right? Because if I'm going to go in and be a partner, I got to prove myself. I got to work hard as a young surgeon and hope for the opportunity to buy into that practice, become an owner one day. Other than that, there's mostly in this area, the tri-state area around New York, DSO opportunities. That's DSOs for dental service organizations. Essentially, they're corporatizing dentistry, just like medicine did with the hospitals, buying up all the outpatient offices. The DSOs, they're not going to settle for you working 3 days a week. No, they want you to work 5 to 6 days a week and 9 to 5 minimum. There's no 5-hour days. So here's the misconception. I thought that by getting to the top, pushing, I'd be able to make more money by working less, or somewhere in the middle, right? Working the same hours and make more, right? I think that's pretty straightforward. I'm literally going on my 12th year of education, right? Next year. 12 years in a row, 4 years college, 4 years of dental school, 4 years of surgery residency. And that's pretty condensed. In medicine, you got people going in 16 plus years sometimes. So there's more information that people need to get before they just go into the profession and the careers. You need to know what you're really getting into. Not to say that I didn't, but when I started into dental school, DSOs weren't very predominant. It was still mostly mom and pop shops, private practices where you go, the dentist knows your entire family. That was when I started. And then in the last 8-9 years, DSOs have bought up everything, and they're backed by private equity companies. So it's very hard to compete with these buy up opportunities. So not to talk your ear off about this, but 30 years doing 3 days a week, and hygienists, you make great money. You do. And that lifestyle is outstanding. You're not going to beat 3 days a week. Even if it's 10 hours a day for 3 days a week, that's really, really good. And I don't know, we need to make sure that that's well known prior to, beforehand. Maki, would it be cheaper to just get numb my teeth and pull out the wisdom teeth instead of being under? That's up to you. It's up to your teeth too. I haven't seen your x-rays. Definitely go to an oral surgeon to have those teeth removed. Your wisdom teeth, they can be challenging. That's what I would recommend. Adam, thoughts of the HPSP scholarship, NHSC scholarship, or just taking loans for dental school? I would say see what you could get. Recognize that those scholarships are going to require you, for example, the Army one. The Army's going to require you, if they're going to pay for 4 years of dental school, they're going to require you to serve for 4 years afterwards at some point in time. So you need to be willing to do that. But it's pretty nice to have it all paid for, isn't it? So those are my thoughts, Adam. Val, what are the best, Val said, what are the best OTC, over-the-counter products to whiten teeth at home? What doesn't work? Great question. In oral surgery, we don't whiten teeth. We're doing the surgical procedures. That would be more of a general dentist, cosmetic dentist, even hygienists might be able to give a really good insight on that. That being said, Kimby's, what are your thoughts on that question? I got a question for you. What do you think about the best over-the-counter products for teeth whitening? Parrot _245. Does OMFS work with the ophthalmology in any cases? They can do that at sometimes. Yeah. Usually everyone knows what teams are going to be involved in cases prior to going in. More often we would work with plastic surgery. I said is the most common time. And it's not very common that we work with plastic surgery in the same cases. But, I'm sorry. Yes, plastic surgery, yes. Because sometimes they'll take like the fibula when we're doing a fibula graft. Maybe it's for mandibulectomy or something. Go Violets. Hey, City MD guy here. Any surgical specialty you would do in another life? No, definitely not. No. Oral surgery is much better than basically all the other surgical specialties out there. Not much better. It's by far and away better than all the other surgical specialties out there from what I've seen, which is a lot. Yes. That's my answer to that one. Official Sports Talk TV, Bird versus LeBron 1v1, who wins? Both in their prime. Well, LeBron would never make it up off the floor because he's going to slip and fall and hurt his ankle and flop. So, come on, give me a better question than that, man. Bird every time. LeBron's going to be hurt the entire first point. LeBron's going to be on his butt. He's going to be hurt. He's going to be complaining bitching and moaning like he always does. Kimby's, that's so true. Yeah, Kimby's, it's crazy, right? So like, everyone thinks it makes so much money. No, you work for that money in certain professions, right? Like Dr. Jay White, agree. What's up, Jay White? What's up, Dr. White? Lou Sassel, I thought this was Alan Tudyk for a sec. Dang, I don't know who Alan Tudyk is. At Steven. Kylie Culver, what's up, Kylie Culver? What's up? What's up? Wait, here we go. Difference between cosmetic dentist and a general dentist. A general dentist is really a cosmetic dentist too, vice versa. Cosmetic dentists are just claiming, or hopefully have the certifications of certain qualifications on whitening, maybe Botox, maybe fillers, maybe different things like that, right? Whitening, veneers, maybe crowns and stuff like that. More cosmetic work, general dentistry. It's really synonymous, I would say, in most cases. Kimby's, that's where I worked. I didn't know that's really too bad. I'm sorry to hear that. No. I'm not trying to complain or something, but we do need to make sure that the all the information is out there, because a lot of the information is hidden, and they don't like you to talk about this stuff apparently. Legolas 168. I think those are Korean symbols. I'm not sure. I don't know what it says. Hannah, what do? I keep failing tests, and my only dream is doctor. I am only freshman, but what do I do? We got to get those test scores up. Hannah. That would be my thing. I would recommend looking into Quizlet Plus. I would pay for it. It's very affordable for the year. Get the annual thing. This way you could get a lot of repetitions to increase your efficient studying and effective studying by getting repetitions in to remember them, and get figures on there. Put figures on there to help remember. We are visual thinkers and rememberers. As learners, we are visual learners. That's how I would harness that and use it to your advantage when you study. User 8933, how do dentists really feel about dental hygienists? I think they're great. What do you mean? User 1071, how do I make my braces treatment go faster? Do everything they say. Make sure you brush around those braces too. You don't want to get a cavity underneath it. Gotti24_. I'm a current D1. When did you know you wanted to do OMFS? Well, I had an idea that I liked oral surgery prior to dental school, but through dental school, it really kind of focused my ambition in on that versus other specialties. I didn't see myself doing anything either oral surgery or general dentistry. I wasn't going to do anything else. Dr. J. White followed the live credit. Dr. White, thank you. I appreciate that. FG Toodle. Any red flags to look up for? Just a bad experience with my kid's doctor. Want to find a good one. Yes. Look up their reviews online prior to. Some of them even have their social media pages linked on their website. Google reviews, Yelp reviews. Look those up. Now, some of them are fake, sure. Some of those reviews are fake, sure. But generally, if they have a lot of ratings and reviews, the average is going to give you an idea what to expect, right? And then if you could look them up on their website and social media page, you can get kind of virtually meet them even before the appointment. Everyone should be doing this, right? And then you know who you're going to. You know what they're going to be like. You get to meet them. That's the virtual pre-consult, I call that. Doughmaker 100. How do I get rid of my tinnitus? I would see an ENT doctor about that. Definitely see an ENT doctor about that, and I would see if it's exacerbated by eating, drinking anything, etc. Kimby's, I like the Crest strips. So, guys, Kimby's likes the Crest strips for whitening. However, if you really want your teeth white, go to the dentist. Got it. Mo Decent Facts. Official Sports Talk TV laughed. Dr. J. White waved. What's up, Dr. White? Amelia Herrera, hands up. Nice. Mo D, can you upload your video with the Bloody Tooth Guy on YouTube? I only found it on Spotify. It's there. Go to my YouTube channel. Same at Dr. Gallagher. It's there, Mo. It's up there. Official Sports Talk TV. And I'll get another. I'm hoping to plan another part 2 in a few months. Maybe like another. It's been a few months, so I'd probably go another 3 to 6 months. Get another part 2. That would be good. Just for a quick chat. I agree as well. LaFlop wouldn't be able to take Bird's trash talk. Oh, that too. Here's the thing. Larry Bird's trash talk was like, he wasn't like talking about your wife or your, like some of these like ridiculous things. He was like, he would tell you, point on the floor, like, I'm going to shoot the ball in your face right here. And he'd go and do it. And I don't know, that's scary. That's scarier, and it's like, it's competitive trash talk. It's not unprofessional. Whatever's going on in the NBA today could be a lot better. That's all I'm saying. Harris Harris Yed _ have you heard anything about Creighton's Dental School, good or bad? Creighton's Dental School, actually, that's one of the few I haven't heard much about. Now, Harris, on the PreDent Mentor Map, you could get it at PreDentMentorMap.org. That's going to have stats, data, tuition, class size, average DAT score of that school. This is current data for all the schools in the United States. My buddy Sean, I created this. It's for free for you. Check it out. Let me know what you think. But there's some stuff on Creighton in there. And I would, if you can, please ask that question. We created a discussion board so you can ask this question and get that from current dental school students that are signed up with us as mentors. So you can ask those questions to them too. All right. They might be biased, but you get the gist of it, right? I would put that question in the discussion board. Harris, let me know if you can do that for me. Okay. And then I'll be able to work because I'm running students of dentistry. We created PreDent Mentor Map. We're linking it to our account, Students of Dentistry. We created that 8-9 years ago, whatever it was. And I'm currently I'm the one on Students of Dentistry. We created that from the start. But this way I can link you up with 1 or 2 current Creighton dental students and we get you the answer you're looking for, right? That's simple. Okay. I got you. Hannah. Okay. Thank you. You got it, Hannah. EVG Toodle followed the live creator. Thanks, EVG Toodle. Thank you, friend. Christine Bowers, extraction or root canal, 18 lower cracked infection. Why keep it? That's a good question. Sometimes a root canal, by getting the nerve and the pulp out of that tooth, which is the source of the infection, sometimes you could get the periapical infection going. You could get bone regrowth around the apex of the teeth called bony refill afterwards, right? That might happen. I don't know your situation, and therefore I can't give you an appropriate recommendation, nor this is a consult, right? I can't give medical advice online and whatnot. That being said, your dentist will be able to steer you in the right direction. Okay. Maybe you want to get multiple opinions, right? Visit the endodontist, see what they think. Visit the oral surgeon, see what they think. They'll be able to give you a good answer. You see, Mike said thoughts on oil pulling. Myth. Get out of here. Come on, oil pulling. Oil pulling, God, like that. Don't fall for that, please. Please don't fall for that. They're just taking your money. User 893355, do you think dental hygienists are overpaid? Would you rather get an assistant or doc for that column? It's a good question, but dental hygienists have certain jobs, right? If you need that job filled, you need a dental hygienist. If you don't need that job filled, or you could do it yourself. If you don't need that job filled, I don't think overpaid. Everyone's paid differently, right? I don't know if we could do it that way. Official Sports Talk TV played a whole game left-handed because he wanted to save his right for the Lakers. Yeah. No way LeBron's ever doing that, right? LeBron's not necessarily tough. I wouldn't put him in the tough column of the NBA. Mike, oil pulling. And I answered Mike. Harris, let me know. Good. Thanks. You said we'll definitely do. Harris, let me know. We'll touch base. Okay. You could always DM me on Instagram. And then you could get in touch there, and then I could get on this for you. Got it? Madeline Vanakin, oh, this is you. Hey, Madeline. This is who? Me? What? Tyler Cost, what are your thoughts on the temporary at-home fillings, like the $3 emergency stuff? LOL. That is exactly what I think of that, Tyler Cross. Go to the dentist to get your fillings, okay? Anything in the... No. $3? Dude, $3? That's going to make this a lot worse in the months to come if you do that. Just see a dentist for these things. Please. Don't be buying something to do it, doing it in your bathroom at home. Chris, were you popular back in high school? No, I wasn't popular back then. I wouldn't consider myself popular back in high school. Truth be told, Chris, actually, I ended up my junior year. I got a cut on my lip here. Sorry about that. I ended up taking physics next to one of the most popular kids. He was the quarterback of the football team. We ended up running track together and throwing the javelin. Peter, my boy Peter Cruz. Shout out Peter. Shout out to Peter. He was popular in high school. And then through him, we became buddies, because we sat next to each other in physics. And it was a funny class. We were juniors, and it was a class with juniors and seniors that were literally on their way out. And here's this story. The physics class at St. Anthony's High School was taught by Miss PAESE. She was a sweetheart, right? But I don't know what it was. The seniors decided to make something called PAESE Olympics. So they would do the stupidest things. They would make airplanes and sit in the way back of the class. And when she would turn around, they would throw it. And whoever got the airplane closest to her or hit her would get more points. Another game was they would go up and talk with her. So Miss PAESE, I got this question, and they put their hand on her desk, and then the last person, whoever, and someone in the class would time it. Whoever would have the hand on her desk longest while they were talking to it wins. And I don't know, the PAESE Olympics, that's what they were called. That was among other games that I'm not going to mention, but oh man, good memory. Yeah. No, I wasn't popular in high school, but Mike, you use coconut oil. It's like $4 for a jug. Yeah, I mean, I would put my $4 towards something else, Mike. I'm not going to be swishing coconut oil through my teeth anytime soon. Emmanuel Fuentes, Harris, I go to Creighton for undergrad for PreDent. Lots of the dental students love the program. Well, there you go, Emmanuel. Thanks for that answer. That's excellent. And Emmanuel, you're also PreDent. Check out the PreDent Mentor Map, okay? And if you need, just contact me, DM me on Instagram if you need anything. I run Students in Dentistry as well. We created that account 8-9 years ago. Let me know how I can be at your resource, okay? Just DM me. I respond to everyone in my DM. Students in Dentistry is wild. It's got 116,000. I can't keep up with that. Just DM me directly, okay? I got you. Let me know. Chris, any words on Smile Direct Club? I got to head out in a few minutes, friends. Last couple of questions. Any words on Smile Direct Club? Yeah, they did more harm for patients than good. And then when they went bankrupt, they abandoned all their patients mid-treatment. This is what happens when you try and save money in a very expensive healthcare career field, that the money is there for a reason. And the problem with the money in dentistry is that the technology goes up. The payments to get the education goes up. The services in dentistry goes up. The inflation of the economy at large goes up. So there's 3 to 4 things there, right? The one thing that I think insurance companies' responsibility should be is to counteract inflation, right? Isn't the whole point of insurance to allow a broader group of people have access to treatment that they need? That's literally, like, the concept is to counteract inflation, right? Well, why aren't they doing it? In the 1960s, the maximum dental benefits premium was $1,000 to $1,500. What is it now? About $1,500 for most insurance policies. If they followed the trend, I put out this article last week. I don't know if anyone read it. I put out this article last week. If they were following the trajectory of inflation, the current premium, if it was $1,000 in the 1960, it would now be $7,649. Yes, it's in the article. Look check out my LinkedIn. It's unbelievable. Therefore, dental insurance is a scam because they're not here to help you clearly. I got into this profession to help people, right? I went into oral surgery because I want to help people get out of pain, fix their teeth, help them get their confidence back and their smile. It's just that simple. I'm here to help people. Dental insurance was created to allow a larger number of patients to afford and get treatment that they need, and they are failing to do so, and no one is pointing fingers at them and say, what's the deal here? And you know what? It's crushing the dental industry because they're not reimbursing treatment that dentists end up doing. Dentists get the blame for it. Dentists are the one actually doing the treatment, and they're not making any money on it. They're not getting reimbursed. How do you think they're going to pay back their dental loans? How do you think they're going to pay off their intraoral scanner to make things less invasive on patients? How are they going to pay off the x-ray machine? I could go on and on. Obviously, this is a very heated topic with me, so I'll stop. But someone needs to start talking about this and make a change. Anna, is dental school or med school harder? So academically, many say that medical school is much more challenging content, right? You're doing a lot more work in dental school, and I can tell you that for a fact, okay? And a lot of oral surgery residents. I'm not an MD oral surgery resident, but most of the residents in my program get their MD too, so they spend 2 years in medical school. Most of them would agree that, look, dental school is a lot more work, but you have a lot more time in medical school, but the content, the studying, and the materials generally harder. Generally, right? Remember, you do about a full year of medical school in dental school, and at the same time, you're treating patients. You're practicing cavities and tooth preps, fillings and stuff. Nikki F40. Hola, Nikki, ¿cómo estás? ¿Huh? ¿Cómo estás hoy, huh? ¿Cómo se tu el fin de semana? Anna shared the live. Thanks, Anna. Appreciate that, Anna. Modi, are you guys using remifentanyl for sedations, any inhalation anesthesia? And when we're on our anesthesia, we're using all of that, right? Remi's great because it's got a fast onset and a quick offset, right? Very quickly, very short acting. we generally don't use Remy for IV sedations with wisdom teeth. That's what I haven't. Schumer, follow the live creator. Thank you, Schumer. Bobbin said, I had saddle block with my knee surgery. It made me incontinent for 3 days. Ooh. Bobbins, I'm sorry to hear that, man. I'm sorry to hear that. Schumer, I'm studying for the DAT, but I'm burnt out, LOL. Burnt out is something some of us have to accept and just keep going, unfortunately. There's the DAT, and then you have all the dental school stuff, and then you have the CBSC, and then you have oral surgery residency, and then you have the oral surgery boards exams. You got a long ways to go, my friend. Get used to it. We're all burnt out. We're burnt the heck out. Emmanuel Fuentes followed the live grid. Thanks, Emmanuel, my friend. Schumer, do you think dentistry is a good career to go into? I thought it was. And I went into it. Let me start working first, and then I'll be able to give you a much more fair assessment on that, okay? Because I'm still in training. I didn't go right into working, right? I'm not doing general dentistry. I'll be able to give you an assessment, more specifically oral surgery. But once I am in it and working, I'll be able to let you know. Taylor, hey, my insurance likes me. Oh, great. Good, Taylor. Good. Do they pay for implants? Schumer said, would I need to specialize to make a lot of money? Some say yes, some say no. I wouldn't be able to tell you that until after. But because the insurance reimbursement rate is so poor, a lot of these dentists today are going to have an extreme amount of trouble paying back the loans they took out to get the education. And it doesn't seem that anyone is trying to come back to get insurance reimbursements to be increased ethically, because a lot of DSOs are taken over so they can buy up multiple practices and use these 16 practices, for example, as leverage to the insurance companies to say, hey, we got 16 practices. If we're going to continue to take your insurance, we're going to need reimbursement on this crown that you're giving for $750 to go to $1,250. And they usually say yes. If you only have one or two offices, they're usually going to say no because they use that leverage against you. This is unethical dealings going on. Dealings are, situations going on in dentistry that isn't in favor of patients or providers. This is a business negotiation. This is unacceptable. And I wish the ADA would step up and talk about this a little more. Right? If I'm wrong, let me know. Let me know. If I'm missing something here, please let me know. Taylor Schumer, you're in school now. Nice. Riley Krolikowski. Sorry, Riley. Thoughts on using bicarbonate with local anesthetic for anesthesia of dental abscesses? I don't know. I haven't done that. I haven't used bicarbonate with local. Or did you mean no bicarbonate? I haven't used that. Good question. I don't know. We just give local. Local's the best thing to give. Pablo, did you really get a Cybertruck order? Pablo, I did. You saw that on my Instagram story. Thanks for mentioning that. Yeah, I did. Yesterday we went to the Tesla dealership, and yeah, I want to drive a Cybertruck. I think when the data shows it, it's going to be the safest thing on the road besides an ambulance. It's electric, so it is safe for the environment. What else? I mean, that's what I want it for, right? I'm not doing it for the looks or, the hype or whatever. It's going to take 12 or 18 months to get it. I put my name on the list, and around 13, 14 months from now, I'll be graduating residency. You can start to make those payments. So hopefully that works. Idiot Sandwich 48. How are your ortho friends doing in the job search? Fairly well. My one buddy, he is working 9 months now, and he just bought his own practice. So he's killing it. And then my other buddy, he's in the conversation right now for contracts and such. Yep. Madeline Vatican followed the live creator. Thanks, Madeline. Thanks, friend. Jesus saved me. Jesus loves you. Thank you, Jesus saved me. Thanks, friend. Taylor, I don't need implants. I like how mine look. Great. Good. Wait. No, like dental implants. Dental implants. You mean you like how your teeth look? Yeah. Well, great. I mean, you're young and healthy. You don't even worry about all this stuff yet. Arlo 234. How do you use an elevator to remove an upper wisdom tooth? Not medical advice, but essentially what you do is you get it in between the crest of the bone, and you use not the other tooth, right? The crest of the bone is beneath the gingiva in most cases, and then you use that to elevate up against the tooth, right? So it's in between the bone and then in between the tooth, and you luxate. It's called luxating, side to side, and you're using the interproximal bone as leverage, not the adjacent tooth. It's very important, and that's how you slowly gain mobility of a tooth, and then you can remove it with a forceps. Or sometimes they just come right out with that. All right, friends, I got to go soon. Idiot Sandwich 48. Which specialty do you go into for all and implants? Could you just do GP? Some people do. You know, surgical specialties are oral and maxillofacial surgery and periodontics. Anyone who's not that, and even periodontists don't have sufficient training for all complications. Unfortunately, the only surgical specialty in dentistry is oral surgery that has the maximum amount of experience with complications. Next after that is periodontics. Even periodontics, this is a very invasive procedure, and a lot of anatomy can be messed with, causing complications, causing problems. All and X is generally reserved for oral surgeons. There are some general dentists doing that. Is that safe? I don't know. It's a question for the lawyers. The periodontists as well. Is that safe when they do it? I maybe. I don't know. It depends on how extensive training that they have with all and X procedures during dental school and whatnot. Even prosthodontists I see are doing all and X. Is that safe? I don't know. Prosthodontists are the restorative dentists. They make dentures. They do crowns. They do the denture over dentures that fit onto implants and such. There's so much that goes into it. You know what I mean? So that's my answer to that. Pablo's is super dope. Pablo, user 1617. I saw that guy pay your rent. That was Juan with That Was Epic. He was here. He was in the apartment, and he did. I had no idea who he was or whatnot. I just came home from work that day. Isn't that hilarious? And then he turned around and said, "Yeah, we're actually here to pay your rent." And I was like, "What?" And he gave me 2,800s on the spot. That was I never cashed that, by the way. It's hidden, not necessarily in my apartment, but somewhere out there in the world. Maybe you can find it. I saw advice on how to do well in A&P, anatomy and physiology. I would use Netter's Guide. This is Ashley asking the question. I would use Netter's Guide, and I would really focus on using the diagrams and such to kind of memorize and understand what structures are what. That's how I did it. That's the best way to do it. If your lecturer, attending professor is really good, they'll take that Netter's diagram, they'll put it on your PowerPoint and have one PowerPoint with the lines to the structures, but not saying what they are. And then the next slide, those lines will tell you what they are. And then you can kind of flip back and forth like it's an index card, and that will maximize your studying for that subject, for anatomy and physiology. Zaini Zulmai, how much were your student loans? Zaini, how's it going? I'm fortunate. My parents have worked very hard, and unfortunately, I had brothers and sisters at one point that didn't make it. So they worked very hard, and they were able to support me with tuition through undergrad and dental school. I paid for things outside of that, rent, groceries, and such. So it was kind of like a balance that we talked about, and an agreement that we had. And I'm very fortunate for that. And I do know that not everyone has that opportunity, but I'm on here to give back, right? I know I'm not in the same boat as far as loans go, but I tried to be honest, right? And I'm still on here to help. Does that make sense? I give my best. I hope you agree, and you understand what I'm saying, right? And I try and help out everyone where I can. I've even made videos on how to look. I don't know how to pay back tens of thousands or hundreds of thousands of dollars of loans, but there are ways to save money and make your money work for you. And after graduating dental school, for example, you could sell those instruments that you have on eBay, on Facebook Marketplace, and get several $1,000s back. Now, I don't know the answer yet to pay back loans, but I try and help where I can, Real life Owen Hunt, Joe Federico said, Elif, follow the live creator. Thank you, Elif. All right, friends, that's it for today. Thanks so much for signing on. This is TikTok Live 22. I will be posting this on YouTube and podcast. And the top 3 listeners of today, I'll be putting in the bio of that, so you'll be able to see it there. All right, friends, thanks so much for coming on. Love you guys. Thanks for being a part of my podcast, fam. You guys mean the most to me. All right, have a great week.